Hello, my name is Pallavi Rathore and I'm from group 155. Today we are going to discuss the method of gastric intubation. In this method, we need some specific kind of equipment that are: first, we will prepare our instrument tray in which we will put a box of tissue, a gastric intubation tube, which comes in different sizes, and also we will put some lubricants and a glass of water. If the patient is conscious, then it would be useful to swallowing, and a tube through for the vomit, and some safe strips and pH strips, and also we will have syringes and a piece of linen, a garbage box. Now, as we discussed about the equipments, the hand hygiene of our is very important to us so that we ain't spread any type of infection to the patient as well as for our safety. So, please don't forget to perform hand hygiene before doing the process, and also perform the identification process of the patient as per the policies of the hospital. That is also important. Okay, so now let's move to the clinical room and perform our task. So now we will inquire our patient that they had any nasal surgery. Now we will adjust their head position so that we can insert the intubation tube. Now I will take the measurement of the intubation tube to the nasal area to the xiphoid process of the patient. So now I took the measurement, so I will put the tube aside. Now I'm going to check the nasal area of the patient if there is problem or not. So it's come to the normal. Now I will ask my patient so they can blow their nose or not. So here my patient blow their nose. Now we will proceed our next step. So now I'm going to insert the intubation tube in the nasal cavity of the patient. Slowly put the tube inside the nostrils and give the patient a glass of water if they are conscious so that they can easily swallow the tube inside. There are several markings present in the tube. Now I will put the doctor's tape to attach the tube over the nasal area of the patient so that it doesn't move through. Before inserting the tube, please apply the lubricant on it so that it can go smoothly. And while inserting the tube, please remember the tip of the tube must be pointed downward, and then when it reaches to the nasal pharynx, please rotate it 180 degree upwards. Now I will examine the fluid coming in the tube by taking it in litmus paper. So as we noticed, it turned the blue litmus paper into the red. So it gives the indication that the position of the gastric tube is in the acidic area. To further confirmation of the position of the tube, we can check it by the X-ray of the chest. Now allow the free drainage. Please don't forget to use mask while performing any kind of procedures so that we ain't spread any kind of infection. So now let's discuss thoroughly. Nasogastric intubation is a medical process involving the intubation of a plastic tube and through the nose, past the throat, and down in the stomach. There is also a process known as orogastric intubation. It is similar to it, but the insertion of the plastic tube occurs from the mouth. It is an advantageous process because with a basic sum tube, we can aspirate the gastric content and assess the residual volume, thereby keeping an eye on the gastric emptying function. While there are some disadvantages of this process are there, like it can cause trauma to mucosa, sinusitis, and the pressure areas on the nares or upper lips. And it also requires the radiological confirmation of the placement and may also increase the aspiration risk. This process is used to treat gastric atony, ileus, or obstruction, remove indigested toxins, and give antibodies and supply nutrients to the patient. Complications of intubations are rare and includes nasophageal trauma with or without hemorrhage, pulmonary aspiration, traumatic esophageal or gastric hemorrhage or perforation. Also, please don't forget to tell our patient about the procedure so that they ain't got
So
anxious.
that's all about the gastric intubation. Thank you so much for your attention. See you next time.